What's going on, everybody, and welcome to the Easy Thyroid channel. We are going to discuss what will happen when you don't take your thyroid meds. So let's jump right into today's video. Well, the obvious thing that will happen when you don't take your meds is your symptoms would return. And I'm not talking about persons who manage to cure their thyroid disease or persons who replace the medication using certain foods to give their thyroid the necessary nutrients. No, I'm talking about persons who somehow decided to wean themselves off the thyroid medication or reduce it to taking it every other day. Guys, let me tell you, I tried to wean myself off my thyroid meds, and that was a big mistake. Let me tell you, I started to feel pain in my left leg, started to experience muscle spasm, and this all happened while I was overseas studying. So at the time, I had a friend who was a doctor, and she will always, check up on me to make sure I'm okay, as I was previously hospitalized for the condition. And I told her what I did, and she was like, no, you just can't decide to wean yourself off the medication. Like, your body needs it, So yeah, once you stop taking your thyroid meds, you can expect that your symptoms would return. So let's look at some of those symptoms, and the ones we are going to look at are at the advanced stage. And the first one is your mental health can be affected. Now, hypothyroidism affects both mind and body. It can make you forgetful, slow your thoughts down, and it can also make it difficult to concentrate. In fact, one of the reversible causes of dementia is hypothyroidism. Now, thyroid hormone deficiency may also affect your mental health. You can experience mood swings and irritation, as these can become more prominent. Anxiety and despair are more common among hypothyroidism patients. Being hypothyroid might also make it difficult to manage depression if you already have it. And I just want to add here that it can slow your speech down. And this was one of my symptoms, One time I was slurring a lot of my words, but at that time I thought it was due to me learning a new language. And then there were times where I would wonder, wait, am I getting a stroke? Like, my speech was just slurring, Like, so many things were going through my mind. Yeah. So number 2 is you may develop a goiter. And a goiter is a result of an underactive thyroid becoming enlarged. Goiters are these bumps in front of the neck that are normally painless. They can make you cough, make your voice seem harsh, and make breathing and swallowing difficult. If the goiter is tiny and causes no symptoms, then it might not be necessary to treat it. But if treatment is required, then it's generally in the form of medicine or surgery. Number 3 is heart disease. A thyroid that is underactive might raise your risk of heart disease, and because it causes your heart to beat more slowly and efficiently. So coronary artery disease and congestive heart failure are more likely as a result of this. To put it in another way, arteries get blocked and the heart may be unable to keep up, right? Number 4, nerve damage. Nerves can be damaged by long-term hypothyroidism. So pain, numbness, tingling, weakness, especially in the hands, are typical symptoms. The carpal tunnel is a tiny passageway in the wrist through which the nerves of the hands pass. So hypothyroidism causes swelling in the tunnel, which can in turn irritate the nerves. And you may also experience hair loss, as this is caused by damage, which is caused by untreated hypothyroidism. Number 5 is fertility and pregnancy. Now, the fertility of a woman is affected by hypothyroidism. It can cause irregular periods, making it impossible to detect ovulation. It may also prevent you from ovulating at all. So a study was done, and hypothyroidism was found in nearly 25% of infertile women. However, the good news is that women were able to conceive from 6 weeks to a year after therapy. Now, if severe hypothyroidism isn't treated for a long time, then it can become life-threatening. The body, it begins to slow down to the point where it gets into a coma. So as I said, these are just some of the symptoms, and it most likely won't be that drastic. It may start off mild, like you may experience fatigue, you may have lower energy. Then eventually it will get worse if left untreated. And trust me, this is something that I would hate for you to experience. I remember there were times when I was in class and I would just like get anxiety attacks, and then I would cry for no reason. It was like a roller coaster, you know, like so many things were going on at that time. So let's move on. So I know that some of you might be curious as to how long you can go without taking your thyroid meds. Well, I would say that it can take a couple of days, maybe a week, before you start to experience any symptoms. As I mentioned at the beginning of this video, there were persons who go without taking their thyroid meds and they're fine. And that's because they know what to do in terms of providing the thyroid the nutrients that it needs. Now, if this is something that you want to do, then I would suggest that you get help from a dietitian and educate yourself, you know. So don't go trying and doing it on your own, because it might just end up in disaster. And I know sometimes there might be times when you miss a dose, and what you should do is take the missed dose as soon as you remember it. However, if it is almost time to take the next dose, then skip the missed dose and continue on your regular dosing schedule. And let me warn you, do not take a double dose to make up for a missed one. That is a no-no. Okay guys, that is pretty much it for this video. Please like, comment, and subscribe. Until next time, bye.